talk on social egg freezing, its benefits, risk, and the process. I always believe fertility is not a matter of chance, it is a matter of choice. Freeze your eggs if you are in 30s and you wish to postpone pregnancy for one reason or the another. It's a revolutionary idea to freeze your eggs. But most girls today in India wants to have great education, want to have a great career, and want to make a name for themselves. But at times they do think that they missed out in having a home by getting married and having children. And then she consoles on the other side, never mind, there is always a solution. So freezing eggs is this revolutionary trend. Google and the Facebook were the pioneers to advocate egg freezing for a larger societal shift towards recognizing family planning choices and career. Is this initiative helpful so far in the world? And what about India? Google and Facebook offer to their female employees to pay $20,000 to have their eggs frozen. And this initiative was followed by big companies and to support women in the workplace by giving them more flexibility in family planning decisions. The impact on a working woman is definitely there in terms of awareness about the oocyte preservation for a woman who wished to delay childbearing for personal or career-related reasons. Economic incentives, if when given by the companies, made the procedure economically feasible for their employees who might otherwise have found it financially challenging. Now, egg freezing is trending in the Western world for social reasons. But what do the global statistics say? In UK, they found there were 460 times increase in oocyte cryopreservation reported between 2010 and 2016. While in the US, it was almost 880 times increase between 2010 to 2015. In Australia and New Zealand, it was over 600 times respectively. Broad acceptability and applicability of this reproductive option in India is still very less. The Human Fertilization and Embryology Authority in UK approved the use of frozen oocytes in 2000 itself, highlighting the using frozen eggs in infertility treatment is sufficiently safe. In 2013, the American Society of Reproductive Medicine Ethics Committee removed the experimental label from the planned oocyte cryopreservation. Now, as for the medical dimensions of the social egg freezing is concerned, we all know that the slow freezing technology was replaced because this caused ice crystal formation, which frequently caused cellular damage. While the quick freezing, that is vitrification, produced no icing on the ice crystals, and this had significantly increased post-thaw survival rates. So this is the difference you can see in the slow freezing and in vitrification, and the advantage by thereby. So vitrification has a better chance of maintaining oocyte quality and structural integrity. Pre-freeze evaluation methods have also made improvements in the selection of viable oocytes by freezing and improved the probability of oocyte survival post-thaw, but also likelihood of conceiving successfully after fertilization and implantation. Assessment of ovarian reserve. We all know that the best marker of the egg quality is the chronological age of the lady. In addition to age, assessment of markers of the ovarian reserve, including AMH concentration, antral follicle count, and a day 3 FSH and E2 concentration can also guide while doing the counseling. A cycle day 2 or 3, FSH more than 10, E2 level more than 80 picogram, AMH less than 1.5 nanogram per mil portrays a poor prognosis in terms of oocyte yield at the time of retrieval. We also know that Endometriosis definitely decreases ovarian reserve, and in polycystic ovarian disease, you have plenty of eggs, but they are not of good quality. And you can find that as for the oocyte morphology and the oxidative stress in these two conditions are concerned, are responsible for stopping the cell cycle and stimulating apoptosis in mature and immature oocytes. Poor quality oocytes seem to be more susceptible to morphological changes such as shrinkage, membrane defects, cytoplasmic granulations, and degeneration. Do not forget egg freezing usage in cancer victim prior to the treatment, which we are doing. Now, improving the oocyte quality by some habit changes probably should be encouraged. There should be suspension of alcohol consumption during treatment. It is beneficial for reproductive outcome. And stop smoking for a period of 3 to 6 months prior to egg freezing probably will be beneficial. Improving your diet, choosing the right food rich in antioxidants with plenty of fruits and raw vegetables can help to reduce free radicals. The use of, here I will say that the people who have a food outside, 80% of the youngsters who are working outside rely on the outside food. The use of antioxidant supplements such as vitamin C, vitamin E, zinc, selenium, omega-3 fatty acids also seem to help balance the oxidative process, which is rampant in every process of infertility. All obese patients, especially those with a BMI greater than 35, should be encouraged to lose weight before starting IVF cycle for egg freezing. Now, what is the prognosis? Fertility awareness. Main prognostic factor, I repeat again, is the age of the woman at the time of egg freezing. The best results are achieved if the eggs are cryopreserved before the age 35 years, which has been shown in meta-analysis. A woman wishing to become pregnant in her 40s with her own eggs, with own fresh eggs, has only 6.6% estimated success rate. But if she had frozen her eggs at the age 30, the success rate would have jumped to over 40 per transfer, 40% per transfer. This shows that earlier the eggs are frozen, the chances of pregnancy success are more. However, the most patients proceed for cryopreservation at the age between 36 and 39 with a mean age of 38 years. And it has been found even in the Western world, 80% of the patients are over 35 years. Now, with the result, you can find that in case it has been frozen at 30, the oocyte survival is around 82%, while the fertilization rate is 67%. But there is a tendency, what is called a habit of perpetual postponing marriage and pregnancy. The parents of perpetual postponings are that people should know that there is a 6% chance of being childlessness at the age 30. It jumps to 15% at age 35 and 35% at the age 40. Just postponing a first conception attempt from 25 to 30 years reduces the mean number of children from 2 to 1.7. This is also one of the main reasons why even India also they want to increase the age of marriage to 21 they have done. Increases infertility prevalence from 10% to 16% and increases incomplete families from 15 to 25%. This is one of the study from France had said. Now, as for a few statistics which are there in India, 60% of childless working women aged 35 to 40 still planning to have a baby, but somehow not been able to find time for it. This study, I attended one of the session in Delhi University, and this was the highlight of one of this research. 30% women aged between 40 to 45 in Delhi University have started thinking to go for egg freezing. It is only thinking and not the reality. The reality, which is not known to majority of the people who come for IVF, live birth rate, At age 40, the chance is 12%. At age 41, it is 10%. And at age 45, it is 1%. Now, in what other branch of medicine would we have let patient insist that I want to have egg freezing, elective procedure, with less than 5% chance of its working? The legal issues. A woman may not necessarily use their cryopreserved oocytes, and this is what the indications are coming. Many of these oocytes stored in the oocyte banks will never be used, and they will form a medical waste. No guarantee of successful conception as true in any IVF pregnancy. And there is just no guarantees as far as the pregnancy part is concerned. The number of children born as a result of this technique is still limited. The long-term studies are not yet available, and the probabilities to conceive from cryopreserved had recently increased significantly, but the chances of conceiving through natural reproduction at a relatively early age are much, much higher. Now, coming to commercialization. Given the very low success rate of pregnancy for egg freezing for a woman in their 40s, the potential for commercial exploitation undeniably exists. When people insist for the egg freezing at 40, again there is the exploitation of doctors, and sometimes IVF centers promoting it is also an exploitation of the patient. I think hard facts must be told to the clients. High cost. Cryopreservation generally is not covered by the insurance, and unless fertility preservation is done due to disease or cancers. Now, there's some trend is there of altruistic donation in UK, which is also a potential exploitation. They say freeze and share arrangement as developed by British Fertility Centre, the London Egg Bank, offered a solution to the high cost. Under this arrangement, selected women get free ovarian stimulation, harvesting, and 1 year storage money in exchange for donating half of their eggs to program where another woman, which is looking for a donated eggs, can be benefited. Is fertility preservation a way of seeking medical answer to a social problem? Using fertility preservation as a solution to that problem might deteriorate the problem further and will not resolve this critical social issue. Cryopreservation would also encourage women to further postpone their pregnancies and risk the adverse effect of high-risk pregnancies in aged mothers and harm to the children caused by having an older or even elderly parent, where there is an increased likelihood of parent death while the child is still very young. So fertility preservation by egg freezing is getting acceptance and popularity in India too. And these are the few guidelines which I have just enlisted, which they require in a counseling session. So to conclude, we have a technology. Working women are trying to get pregnant when older. They want to have their own genetic child or children. There are fewer enthusiasts in India so far. If we wish to encourage egg freezing, they should do it at a younger age, as the pregnancy rate with vitrification are similar to fresh when using young eggs. Now, the steps of egg freezing are taking a medical history and on initial consultation and treatment plan discussion. Ultrasound will be done for ovarian follicles and blood tests for hormone levels of day 2 and day 3 of the menstrual cycle. Then final treatment plan and discussion. And then the start of egg freezing processes with assigning the consent and ovarian stimulation. Monitoring, check ovarian response to medication from regular blood tests and scans, which is done every 2 to 3 days. And the trigger is given after that 36 hours before the egg collection. And then egg retrieval is done, where the patient is assured that she will not have any pain. And then egg freezing and the storage is done. So this is